Let's start with something you might not have heard of, L-methylfolate. It's the active form of folate, also known as vitamin B9, that helps your brain produce neurotransmitters like serotonin, dopamine, and norepinephrine. If you have low levels of methylfolate, your body struggles to make enough of these feel-good chemicals, which can worsen depression. Here's how it works. L-methylfolate helps create something called tetrahydrobiopterin, also known as BH4, which is a cofactor your brain needs to activate certain enzymes that produce serotonin, dopamine, and norepinephrine. A cofactor is something that is needed for something else to work. Without it, these enzymes just sit there twiddling their thumbs. These two enzymes include tyrosine hydroxylase and tryptophan hydroxylase. Think of it like you're trying to bake a cake without flour. L-methylfolate is the flour to your cake. If there's no L-methylfolate, then there's no monoamine neurotransmitters, aka serotonin, dopamine, and norepinephrine. In fact, while it is of course helpful to check for blood levels of folate, and if it's low, to replete it, even if your folate blood levels show a normal level, L-methylfolate might still work for your depression. And the reason why is because blood folate levels measure both folic acid and L-methylfolate. L-methylfolate is the active form of folate that the body uses and the form that can cross the blood-brain barrier to do things like increase serotonin and norepinephrine and dopamine. Folic acid, on the other hand, is a man-made form of folate that your body has to convert into the active methylfolate. But actually, a lot of people have a genetic variant where they have a deficiency in the specific enzyme called MTHFR enzyme, which is what is needed to convert the folic acid into the methylfolate.